Good afternoon, everyone. Today, the topic of the lecture is ethics in dentistry. Myself, Dr. Sugandha Agarwal, will be taking a lecture from the Public Health Dentistry Department. So, what is ethics? Importance of ethics. Our action affects not only ourselves but also those around our professional decisions involve ethics. If we tell a lie, we can lose someone's trust and undermine our own integrity. Ethics refers to a set of rules that describes acceptable conduct in society. Ethics serve as a guide to moral daily living and help us judge whether our behavior can be justified. It is our actions that are determined by moral decisions and based on our values. Derived from the Greek word ethos means a distinctive character, spirit, and attitude of a cultural group. Why do we need? Field of medicine is highly challenging, constantly evolving in terms of discoveries, technologies, human and social needs. Since its complexity of special care, pressure of work and medical advancements can distract doctors from expectations of the patients. We, as doctors, must conscious about ethical decisions and professional conduct, along with the clinical managing patients. Medical education is incomplete without awareness of ethical principles and moral behavior towards the patient. Ethical conduct is essential for not only to be competent for patient only, but also be to preserve the reputation of medical profession. A physician should uphold the dignity and honor of the profession. Whosoever choose profession assumes the obligation to conduct himself in accordance with its ideals. Now, what are the principles of ethics we should follow to do no harm, to do good, autonomy, justice, truthfulness, and confidentiality? To do harm, to do no harm. Hippocratic pioneer in Greek medicine has laid an emphasis on to do no harm. As per this, the first and the foremost duty of healthcare profession is to ensure that his action do not harm to the patient in any way. Use of unsterilized instruments, underfilling and overfilling, carelessness in holding the hard and soft tissue of the mouth. Such circumstances are has to be avoided in the best interest of patient by carefully thought and implemented healthcare. To do good. This principle is also attributed to Hippocrates. Beneficence refers to the principle of promoting or doing good. Should also think about welfare of the patient. Put the patient best interest as priority. Autonomy, self-governance. The dentist should educate the patient to his or her best regarding the treatment. Treat the patient according to the patient's desire. Information given should be easily understood. Respect the patient, right to self-determination and confidentiality. Justice, that is fairness, dealing with the patient justly and delivering dental care without prejudice. Treating people fairly without discrimination of socioeconomic status, race, creed, color, gender, or national origin. Truthfulness or veracity, patient-doctor relationship based on the mutual trust. That is, the dentist has a duty to communicate with his parents truthfully. The dentist should not represent the care being rendered to their patient in a false or misleading manner. Patient accept the dentist to be truthful about the information given, treatment rendered, and the prognosis. Confidentiality. There should be understanding between the dentist and the patient. Any information revealed by the patient to the dentist will not be divulged without the patient's consent. Except the situation where disclosure is needed to protect other patients itself and the community. Now, duties and obligation of dentist towards the patient. Every dentist should be courteous, sympathetic, friendly, and helpful. He should be ever ready to respond to call of his patient. He should ever remember that the treatment of the patient and cure of the disease depends on the skill and prompt attention shown by him. He should observe punctuality in fulfilling his appointments. A dentist will not permit consideration of religion, nationality, race, or social standing to intervene between his duties and his patient. Now, duties of dentists towards one another. Every dentist should cherish a proper pride in his colleagues and should not disparage them either by act or word. When the dentist is entrusted with the care of the patient of another, is entrusted with the care of patient of another during the sickness or absence, mutual arrangements should be made regarding remuneration. Duties towards a community to participate in the community affair, educate the public in promotion of healthcare, to be trustworthy and honest, to honor his parents, to follow community laws, to use the social services provided, to take leadership role in community and elevate the esteem of the profession. Thank you. This is all about the ethics in dentistry we should always follow in our profession. Thank you.